Welcome to Lecto. Today we are going to discuss diuretics. In this lecture, we will discuss the basic components of the nephron and the effect of the diuretics on the different parts of the nephron. Diuretics are basically those drugs that increase the volume of the urine. So diuretics actually work as when we increase the concentration of the different electrolytes in the nephron, then water will retain with these electrolytes and automatically the volume of the urine will increase. So before we start proper lecture, I want to show that lot of students say that pharmacology is a tough subject, but I don't think so, because those students say that pharmacology is tough who have weak grip on anatomy and physiology. So if you have a strong grip on the anatomy and the physiology, then pharmacology is very easier subject for you people. So first of all, you should have to grip on the physiology and the anatomy. Then pharmacology is very easier for you people. So let's start. So first of all, we will discuss the basic components of the nephron. So here you can see the first component is the glomerulus. So here is the glomerulus, which is actually the mesh of the capillaries. Blood entered in the glomerulus to the afferent arteriole and exit the glomerulus through the efferent arteriole. Next component is the Bowman's capsule. Next component is the Bowman's capsule, which surround the glomerulus. And next is the proximal convoluted tubule. So next component is the proximal convoluted tubule. So if we move further, then you will see the loop of Henle. Loop of Henle has three basic different components. So first you will see that the descending loop of Henle, this if it will move downward, this is the descending loop of Henle and it actually thin. So you will see that descending loop of Henle is actually thin in diameter. And if we see that another loop of Henle, which is called ascending loop of Henle. Ascending loop of Henle. Ascending loop of Henle has two components. The starting initial component of the ascending loop of Henle has small diameter relative to the late ascending loop of Henle. So initial is small in diameter and the later is large in diameter. Next is the distal convoluted tubule. Distal convoluted tubule, in it has further two components: early distal convoluted tubule and the late distal convoluted tubules. So and last is the collecting duct. And last is the collecting duct. We further categorize collecting duct according to the position in the kidney. So here you can see, if you see that kidney has two major portion, cortex region and the medulla. So outer will be the cortex region and inner will be the medulla. So if the collecting duct is present at the cortex region, then it is called cortical collecting duct, and if it is present in the medulla, then it is called medullary collecting duct. So we divide the collecting duct further into the two categories on the basis of the position. So diuretics are, we divide the we categorize the diuretic into different classes. So you see that first one is the thiazides. Next is the loop diuretics. Next is the loop diuretics. And third one is the potassium sparing diuretic. We divide the further potassium sparing diuretic into two. First is the aldosterone antagonist, and second is the, you will see that the sodium channel blocker. So you will see that we categorize this is potassium sparing diuretics into two: aldosterone antagonist and the sodium channel blocker. Next is the carbonic anhydrase inhibitor. So this is actually inhibitor which inhabit the carbonic anhydrase enzyme. And last is the osmotic diuretics. So this is the last. So these are basically the different categories of the diuretics. So thiazides include, you will remember it by the ICMH. So this is the basic mnemonics which includes the indapamide, chlorothiazide, chlorthylidone, metallazone and hydrochlorothiazide. So these are basically the different types of the thiazides. If we talk about the loop diuretic, you will see that B fit, it includes bumetanide, acrinic acid, furosemide and torsemide. Next, potassium sparing diuretics further categorize aldosterone and the sodium channel blocker. Aldosterone includes, you will remember it by the AD, so ADC. So AD include amiloride and triamterene. So this is the sodium channel blocker. And aldosterone antagonists include spironolactone and eplerenone. Carbonic anhydrase inhibitors include acetazolamide. So you will remember carbonic anhydrase include acetazolamide. So this is the carbonic anhydrase inhibitor. And osmotic diuretics include mannitol. So this is basically the general overview of the diuretics, and we will discuss all these diuretics in upcoming lectures. So first of all, we will discuss the first part of the nephron, which is the proximal convoluted tubule. So here you can see that this is the part of the proximal convoluted tubule, and you will see that this side is basically the tubular region. This is the tubular region, and this side is basically the interstitial space. This is the interstitial space. Actually, the tubular region inside the tube, the region which is present inside the proximal convoluted tubule is called tubular region or tubular lumen, and the region which is present outside the proximal convoluted tubule, which is called interstitium. And after the interstitium, you will see that here you will see that different blood supply. So between the tubule and the blood supply, you will see the interstitium space. So substances move through the interstitial space. So first of all, substance like sodium move from the tubular lumen into the interstitial space and then into the blood vessels. So keep remember, substances do not move directly into the tubular lumen into the blood. So there is actually a space which is called the interstitial space. So in that situation, these substances, when the blood pressure, when the blood come to the glomerulus and the filtration occur at the glomerulus, and the different substances move into the Bowman's capsule and then into the proximal convoluted tubule. So all the substances like different electrolytes and lot of water filter through the glomerulus, but red blood cells and different protein do not filter in the glomerulus. So in that situation, this is the tubular region and this is the interstitial space. So you will see that this is actually the tubular, this is actually the tubular region. So in that situation, you will see that H positive and HCO3 negative. So this is the hydrogen ion, this is the bicarbonate ion. These ions combine spontaneously and form the H2CO3 carbonic acid. So this is actually the carbonic acid which is produced in the tubular region, and it will convert into the carbon dioxide and the water in the presence of the enzyme which is called carbonic anhydrase. So basically carbonic acid convert into the carbon dioxide and the water in the presence of the carbonic anhydrase enzyme. Then this carbon dioxide and water enter into the epithelium of these proximal convoluted tubule. Actually this tubule is formed by the epithelial layer. So this is actually the epithelial cell. This is the epithelial cell. Epithelial cell. So in that situation the carbon dioxide and water enter into the epithelial cell, and when they enter, then carbon dioxide and water combine together and form the again the H2CO3 which is the carbonic acid, again in the presence of the enzyme which is called carbonic anhydrase. So carbonic anhydrase involved in the conversion from the carbonic acid into the carbon dioxide and water, and again carbon dioxide water to carbonic acid. So carbonic anhydrase is actually involved in the interconversion of the carbonic acid to carbon dioxide and water. So next, carbonic acid convert spontaneously into the hydrogen ion and bicarbonate ion HCO3 negative. So this is the situation. Now these two ions move in different direction. So you will see that if I write it here, so HCO3 negative and this is the H positive. This is the H positive. In that situation, this H positive ion which is present in the epithelium will move in outside in the tubular lumen, in this region, tubular region of the proximal convoluted tubule, and along with sodium will move inside. So here is the situation. The hydrogen ion move outside in the tubular lumen, and from the tubular lumen sodium will move in the epithelium. So this is the basic concept. Next, this compound which is the bicarbonate ion, so it will move in the interstitial space. So now the sodium which move inside the epithelial cell, then where does sodium will move? So in that situation the sodium which is present in the epithelium will move outside in the interstitial space, and along with the potassium will move inside. So this is basically the sodium potassium pump, and you will see that sodium potassium pump is very important in the transportation with the usage of the ATP. So this is the whole process. In that situation you will see that this is the whole process, that in whole process you will see that overall, so there is an exchange between the carbonic acid and the different ions which is produced by the carbonic acid. So if the diuretics attack on the carbonic anhydrase, then what will happen? So like you will see that this is the carbonic anhydrase inhibitor which inhibit or which block the carbonic anhydrase enzyme. So in that situation, if I block these carbonic anhydrase enzyme, then what will happen? If I block this enzyme, then the carbonic acid will not convert into the carbon dioxide and the water. So it will remain in the tubular region. If I block this, then what will happen? Carbon dioxide and water will not convert into the carbonic acid, and carbonic acid not convert to the different ions H positive and HCO3 negative. So in that situation, if H positive is not produced, then it will not move into the tubular region, and in that situation sodium will not move inside the epithelium. So overall, you will see that the sodium, which is very important in the transportation from the tubular lumen into the epithelium, will block. So if the concentration in that situation, the concentration of the sodium will increase in the tubular region. So in the proximal region, you will see that the sodium concentration will increase. So if the ions or the solute concentration increase in these tube, proximal convoluted tubule, then what will happen? Then water will prefer to stay with the sodium, because when there is a lot of solute, then water prefer to move from low solute concentration towards the high solute concentration. This is the basic process. Water move from low solute concentration to the high solute concentration. So in that situation, water molecule will also retain in the proximal convoluted tubule. So in that situation, overall volume of the urine will increase. So in that situation, you will see carbonic anhydrase inhibitors attack on the proximal convoluted tubule of the nephron. So next, we will move forward. Then ascending loop of Henle. So before we discuss that, loop of Henle has two components, descending and ascending. If you see that in the descending loop of Henle, there is no as such important process, just water molecule which is present in the tubule will move into the interstitial space. This is the normal process in which the water molecules move from distal convoluted tubule and in the through the counter current mechanism. But ascending loop of Henle is very much important in this point of view, that which is actually, I am talking about thick part of this is the thick part of the ascending. Thin will be the same as the descending loop of Henle, but ascending loop of Henle having thick portion. So first of you will see that ascending loop having thick component. In that situation, you will see the important transporter which is called, you will see, which is called NCCK. You will remember it by the NCCK. In that situation, again you will see in all the whole the lecture, you will see this is the left side. Left side will be the interstitial space, and this is the tubular lumen. Tubular lumen. So in that situation, this transporter will transport different ions, like it will transport the sodium inside the epithelium. Next, it will transport two chloride ions inside, and one is the potassium. So this transporter will transport sodium chloride and the potassium. So these are basically the different ions. Next, you will see that this first sodium now will move in the interstitial space through this way. This will move to the ATP, and in that situation, sodium will move inside, and along with, you will see that the potassium will move inside the epithelial cell. So in that situation, there is an exchange. Sodium will move in the interstitial space, and from the interstitial space, potassium will move in the epithelial cell. So this is basically the exchange. And next, if we see that sodium, this is the sodium move inside, and along with H positive move outside the cell. So in that situation, sodium has two paths. It can also move through this transporter, and it can also move through this transporter. So sodium has two pathways. It can move into the epithelial space to different transporter. So in that situation, sodium automatically, this sodium will also move through the sodium potassium pump into the interstitial space, and potassium will move opposite. So now this chloride ion will move inside the interstitial space through a different channel. So this is another pathway. And last, the potassium. Potassium has two pathways. It can move in the interstitial space, and it has another pathway. It can also move into the, again, back to the tubular lumen. So this is the basic concept. Two transporter which is present in the ascending loop. In that situation, sodium move inside the epithelium, both the transporter. Sodium will move interstitial space through the ATP pump, and chloride will move automatically into the interstitial space through a different channel. And potassium has two pathways. It will move interstitial space. If the potassium will move in the back to the tubular lumen, then what will happen? The concentration or the positivity of the tubular lumen will increase. Then what will happen? Then the different ions, lot of other ions like the calcium and the magnesium, which is already present in the tubular lumen, will move through the paracellular space into the interstitial space. This space which is present between the two cells is called paracellular space. And the calcium and magnesium, due to the excess positivity which is caused by the potassium, in that situation calcium and magnesium move through the paracellular space into the interstitial space. So overall you will see this is the whole process which actually happens in the ascending loop. If we use loop diuretic, then what will happen? Loop diuretic actually block this transporter. If I block this transporter, then what will happen? Then the sodium chloride and the potassium will remain in the tubular space, and if the electrolytes or the ion solute concentration increase in the tubular space, then water will also retain in the tubules. Then overall concentration or filtrate or the amount of the urine will increase. So in that situation, solute retain in this region, ascending loop, and along with water also retain in them. So in that situation, the overall volume will also be increased if we use the loop diuretic. So this is the loop diuretics, and we have discussed carbonic anhydrase. Next, if we see distal tubule, we divide early and the late. So first of all we will discuss the early distal tubule. So in that situation you will see like same, this is the interstitial space and this is the tubular lumen. So in that situation the sodium and the chloride, this is the co-transporter which move this ion in the same direction. So in that situation, this transporter transport the sodium and the chloride in the epithelial cell. So in that situation, sodium will have to move into the interstitial space. So this sodium will move into the interstitial space through the ATP pump, and along with that the potassium will move inside. So this is actually the opposite process. And next, this chloride will move also into the interstitial space through another transporter. So this is the actual process, and you will see that ATP pump you will see use almost all the process. Here you can see that this is the ATP pump, this is the ATP pump, and this is ATP pump. Sodium potassium ATP pump is very much important, and in that situation if I block this transporter, then what will happen? So this transporter is blocked by the thiazides. So if I block this channel, then what will happen? Then the sodium and the chloride concentration increase in the tubular lumen, and if the solute concentration increase in the tubular region, then water also retain and overall urine volume will increase. So this is the early distal tubule. Next we divide the distal tubule into the late distal tubule. So in that situation you will see this is actually the late distal tubule, or you can say cortical collecting duct. So late distal tubule and the cortical collecting duct have same cells. Both of these components have two cells, principal cells and the intercalated cells. I repeat that late distal convoluted tubule and the cortical collecting ducts have same cells, principal cell and intercalated cell. So in that situation you will see that like this is the interstitial space and this is the tubular lumen. So in that situation, most important thing, in the principal cell you will see that here you see that the potassium move outside. Potassium will move outside, and you will see that the sodium move inside. Sodium move inside along with the chloride. Along with the chloride. So I repeat that this transporter transport the sodium and the chloride inside the cell, just like this one. And again you will see potassium will move in the tubular lumen. So this sodium now will move into interstitial space through the sodium potassium bond. So it will move in the interstitial space, and again potassium will move outside. So this potassium which is moved inside the epithelial space will move in the tubular lumen, and this sodium transport in the interstitial space. Sorry, this is the interstitial space and move through the ATP pump. Again ATP pump, and this chloride which entered in the epithelial space will move in the interstitial space through another transporter. So this is basically the process which actually happens in the principal cell. So two types of diuretics. Here you can see potassium sparing diuretics actually acts on this process. On this process you will see that the potassium sparing diuretic act. So first is the aldosterone antagonist. Aldosterone antagonist. So here you can see that this is the aldosterone receptor. This is the aldosterone receptor which is present on the epithelial membrane. So if potassium sparing, or you can say aldosterone antagonist, block this receptor, then what will happen? This receptor will block this transporter. If I block this receptor by the using of the aldosterone antagonist, then this receptor block all the process in the cell, and including the transporter of the sodium and the chloride. So in that situation, the sodium and the potassium, sodium and chloride will retain in the tubular lumen, and if the sodium is not transported into the epithelium, then potassium cannot move outside. Next is the intercalated cell. It has two types, A type and B type. So these are basically the two types of the intercalated cells. So first of all you will see that again this is the interstitial space, and this one is the tubular lumen. So in that situation, first of all you will see that the carbon dioxide from the interstitial space move inside the cell. So in that situation, carbon dioxide will move inside the epithelial cell combined with the water, and it result in the formation of the H2CO3 carbonic acid, which is help of carbonic anhydrase enzyme. So this again convert into the HCO3 negative and plus H positive. So it convert into the two ions spontaneously. So this H positive ion has two options. It can either move in the tubular lumen by the ATPs. So this is the ATP pump which is only used for the potassium. Next, this potassium can also move through this. Move outside, but along with potassium will move inside. Potassium will move inside. So this is the two process. ATP pump which is only for the H positive, and this is another ATP pump which is actually the co-transporter. But H positive move outside and potassium will move inside. So in that situation, now this bicarbonate ion move inside the interstitial space HCO3 negative, and along with chloride will move inside this way in the interstitial space. Now this chloride which move inside here, this chloride will move in outside through this channel, different channel. This is the chloride channel, and last the potassium will move inside the interstitial, will move in the interstitial space through the potassium channel. So here this is the whole process which happens in the intercalated cell. So this is the type A. Type B is just opposite to the type A. In that situation you will see that this is the tubular lumen and this is the interstitial space. Then what will happen? First of all, carbon dioxide enter into the cell. So carbon dioxide combine with the water and it will form the H2CO3. H2 convert into the HCO3 negative and plus H positive. It or dissociate into the two ions. And these two ions has two options. This ion move inside this interstitial space. So H positive will move through ATP pump in the interstitial space. It can also move through this one. It will move inside and along with you will see that like this way H positive and potassium. So from the interstitial space potassium will move inside the cell. So in that situation this bicarbonate ion has another option. It will move outside HCO3 negative and along with you will see that the chloride will move inside. Same just like this, bicarbonate and chloride, bicarbonate and chloride, and chloride will move in the interstitial space through this pathway. And last is the potassium which move from the interstitial space will move outside the which is actually the tubular lumen. This is the process which actually happens in the intercalated cell in the type A and type B. Type A, type B is just opposite to each other. And the important things which you have to remember, there is a receptor which is called the V2 receptor. V2 receptor is basically vasopressin. Vasopressin, or you can say antidiuretic. Antidiuretic hormone, or you can say vasopressin, act on the V2 receptor. Antidiuretic actually involved in the reduction in the volume of the urine. So in that situation, if there is increase in the antidiuretic hormone and which will attach to this way, then overall you will see that the absorption of the water from the interstitial space. Here you will see that the water absorption from the tubular lumen into the cell or into the interstitial space will increase. So if ADH is increased, then water will absorb more and more. So in that situation, the overall volume of the urine will decrease. But if there is a decrease in antidiuretic hormone, then the absorption will block and we will see the increment in the volume of the urine. So antidiuretic hormone has an important effect in the increase and the decrease of the volume of the urine. Last important point is alkalosis and acidosis. So this is the two important terminologies. In that situation, you will remember it by the MD. You will see that HCO3 negative and this is also HCO3 negative. So in acidosis, the pH is actually in decrease. So if the pH decrease in the acidosis, it's mean that the H positive is also increased. So this is the metabolic condition. These are basically the metabolic signs. And D stand for direct relation. If the pH decrease, then this concentration will also decrease and it causes acidosis. So in alkalosis, pH increase. So along with the pH increase, then bicarbonate ion also increase. So it causes the alkalosis. So you will see that if I block this cotransporter, then the HCO3 concentration will decrease. So HCO3 concentration decrease in acidosis. If I block this channel, then what will happen? Then the HCO3 will not move outward and it will increase concentration in the cell. So in that situation, if the HCO3 concentration increase, and obviously it will also again move backward into the interstitial space, so it causes the alkalosis. So in acidosis, you will see that the bicarbonate ion concentration will be low, and in alkalosis you will see that the bicarbonate concentration or ion will be high. So this is all about the diuretics. So if you have any question, then you may ask in the comment section. Thank you.